Ann Parkland is rising with a question.
Thank you, Mr. Speaker. It was said by a constituent in one of our rural crime town halls that we don't have a crime problem, Mr. Speaker, we have a drug problem. In the larger cities, even in my constituency, there are people who are struggling with the opioid addictions. They want access to treatment and they want to recover. Unfortunately, however, there is often lack of support available to them. Mr. Speaker, we need to support all Albertans when they reach out for help, no matter where they live. To the Associate Minister of Mental Health and Addictions, how will the expansion of the virtual opioid dependency program announced today help my constituents access timely care?
The Honourable, the Associate Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. Thanks for the great question. I am concerned about the overdose in our province and the increase of fatality that related possibly to the increased use of carfentanil in the street. That's why earlier today we announced that we're expanding access to virtual opioid dependency clinics throughout the province. Mr. Speaker, we're making every way possible to increase access for Albertans to get out of addiction.
The member for Ann Parkland has the call.
Thank you, Mr. Speaker. Given that one of the challenges Albertans face when trying to access medical assisted treatment is not having access to health benefits plan, and Albertans accessing opioid treatments need to be able to access medication in a timely manner, and that previously Albertans have not been able to access these life-saving medications unless they have a benefits plan. To the Associate Minister, how can Albertans requiring this form of treatment get them without medical coverage, and what difference will it make in their lives?
The Honourable, the Associate Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. The second part of our announcement today is about this program. It's called gap coverage. So we immediately opened the treatment and medication service for people who are waiting to get their Alberta Health Care applied for. So that is an additional $2 million we inject to the system. Mr. Speaker, this marks our continuous effort to build a full continuum of care in Alberta.
The Honourable Member.
Thank you, Mr. Speaker, and thank you to the Associate Minister. Mr. Speaker, given that the previous government did not give Albertans a pathway to move forward after beginning an opioid treatment medications, and our government has prioritized a full continuum of care to ensure Albertans, every Albertan, has the opportunity to access treatment and to begin a better life, and that the ultimate goal should always be a healthy life in full recovery. To the Associate Minister, how are these programs going to assist Albertans in accessing other services needed to enter recovery?
Associate Minister.
Thank you, Mr. Speaker, and through you to the honourable member. I can't be more agreeable to you that the previous government did nothing to help Albertans get out of addiction, but we're going to change that. With today's announcement, it's further complement the government's strategy to create 4,000 additional treatment spaces for Albertans. Mr. Speaker, in this area, we're leading the nation to help people get out of addiction, live a healthy life into recovery. We're very proud of that.